This is Grace. My name is Grace. Channel Baby Matu. So in today's video, I will talk a little bit about my myomectomy I had about 6 months ago. I did promise myself to finally record something, at least few minutes video to at least document what happened on my during my myomectomy, the recovery process, the pain, the unexpected. Anyway, okay, so 5 months ago or 6 months ago, it was the May 17th. So I had myomectomy. The doctor removed a total of maybe eight or nine fibroids. 8 or 9 fibroids. Sorry. The bigger one was the biggest was 8.5 centimeters. For those who have fibroids, if you have fibroids, you know, your doctor will not do any transfer for you unless you have your fibroids removed if they are bigger than 8.5 centimeter. So the biggest fibroid was 8.5. He removed the biggest one and then maybe 7 or 8 smallest. So I had a pre-surgery appointment. I saw a nurse practitioner. I did not know how much they were gonna do before the procedure. They did blood work, of course, to check see if my blood level was enough or if I was anemic, just in case of blood loss. So they can do, I can get blood transfusion on that day. So they did EKG, let me see, blood work, EKG. They did a physical, if I remember. I did a physical also before I get before the surgery. Everything was normal. Blood work was fine. My hemoglobin was 34.8 before the surgery. 34.8. Hematocrit was, oh no, I'm sorry, I messed up. Sorry. Hemoglobin was 14 before the procedure. Hematocrit was 34.8. HNH. So my HNH was 14.8 and 34.8. That was before I went for the surgery. Then during the procedure, I did not need any blood transfusion. Okay, so I didn't need any blood transfusion, which was good, a good thing. I had my general anesthesia, put me to sleep. The first thing or the only thing I know before I passed out, I saw when the nurses pushed me to the room, I saw a big light, very beautiful room, part of the room, and I saw a big light. It was around 1:30ish. Within a second, I think I fall asleep. I woke up at 6:30 p.m. So from 1:30, 1:45 to 6:30 p.m. When I woke up, I was in pain. My stomach was burning. I was in pain. I was like in the la la land. I did not know what was going on, where I was, anything. Then within seconds, I remember, oh no, okay. I asked the nurse, what happened? I am in pain. Did they already do the surgery? The nurse looked at me like, lady, it's been at least 5 hours. So the nurse said it's already done, like 5 hours ago. So from 1:45 to 6:30, I was basically, I hate to say, okay, I was asleep, just to not to say anything more. So at 6:30, I asked the nurse what if the procedure already done, because I woke up in pain, my stomach burning, and she, after she explained to me that the surgery already done, so she got me pain medicine. I was still sleepy, drowsy. I was out of it. So listen to that. The nurse put a pill in my mouth. She put it in my mouth. She was about to give me water. Then there was a manager coming in to check on me and see how, check on me and the nurse, I guess. And the nurse said, oh, she is finally awake. I am just giving her pain medicine now. I'm giving her this pill. And the nurse manager said, whoa, don't give her this type of pain medicine. She's already sleepy, drowsy. Look at her. She can't even keep her eye open. So I spit it out. I gave her the pill back. I did not, thank God, I did not swallow it, because they were waiting for me to get better, just at least be able to stand up, to walk, get to my car and go home. Of course, I was not the driver. I had a designated driver. So I gave the nurse her pill back. I gave her medication back. She took it from me. And she gave me ibuprofen instead of that pain medicine. And I said to myself, you as a nurse, you should have known that you should never take that pill, because it will make you even more sleepy and drowsy. I blamed myself for a few seconds, but I was in the la la land anyway. So I took ibuprofen. Then the manager explained what's gonna happen. I had a Foley. They put a Foley on me right before the procedure. I did not know if I had a Foley catheter, except I woke up with something burning on my stomach. I was in pain. Then I felt like there was a foreign, something strange down there. So when she said, you have a Foley, I looked down and I saw the bag, I saw the catheter. So anyway, and she said, you will need to be able to stand up, get off the bed, go to the bathroom really fast to empty your bladder after we remove the Foley before we send you home. You have to be able to pee on your own. I could not even stand up or keep my eye open. So it was basically impossible. So they tried to have me stand up. I couldn't. They put me back to bed for another 15 minutes. Another two other nurses came back to help me to stand up. So they remove the Foley and they fill up my bladder with, God, I don't remember how many ml of normal saline, but they put a good bit of normal saline, fill up my bladder, and then to have me go to the bathroom to empty my bladder just to make sure I can urinate before leaving the hospital. It was hard. I told them I cannot stand up and run to any bathroom right now because I am dizzy. I am sleepy. I feel sick. So the nurse listened to me, and the other two nurses, they said, okay, we have to do something different. So they pushed the bed nearby the bathroom, the toilet. Then two of them helped me to get up, to sit on the toilet. And yeah, so that helped. I sat down and I was able to empty my bladder. And everybody was, yay, yes, thank God, now you can go home. So, yeah, so like 1 hour later, I was sent home. They put me in a wheelchair. So yes, you're gonna be in a wheelchair when you're leaving the hospital. They put you in a wheelchair and push you out to your car and your designated driver, family, your driver, could be anybody you know, help me to get in the car. So two techs and my driver helped me get transferred to the car. It was so painful going home. I told my fiance at that time, please don't drive fast because I am just hurting. And one thing I forgot to say is that I was nauseated. They give me a bag from the hospital just in case I had to throw up, so I can use that bag. And they told me it was all related to the anesthesia. That's why I was nauseated. So get in the car, so much pain, but I made it home anyway. So I got home. I was in pain. I was in pain. I was nauseated, dizzy, sleepy, and then I was hungry. I was very hungry from not being eating from since midnight the night before to until around 8-9 p.m. So I was very hungry and sick and pain and everything. So got home. I was due for pain medicine. I took pain medicine. I ate something while laying flat in bed because I was too sick, too much pain, too dizzy, too tired to even sit up to eat. So I swallowed something just to make sure I got something in my stomach. So that was the night of the surgery. Slept in pain. The ibuprofen and the other medicine they prescribed didn't do too much for me. So the next day, the pain was just a little less. I took Tylenol in between also. The pain was a lot. To stand up, to get out of bed, the pain was too much. So be aware you're gonna be in pain. Pain medicine help, but you can't really take it every hour, every 2 hours or so. You have to wait at least every 4 to 6 hours, depending on what the doctor prescribed. And I was told to spend very little time in bed. Believe me, the pain was too much. The bed was the only comfortable place for me to be, so I stayed in bed on my back because I had one, two, three, four little incisions, one here, and then I had what they call the big C-section cut. The C-section cut is the one they cut you down here. It was like maybe 10 centimeters, 8 to 10 centimeters. I don't really know how many centimeters it was. But anyway, this thing was hurt in all of them. So I could not lay on my side. I had to be on my back for days and days. In the morning, I had to get up to go try to sit in the living room. The pain was still there. The pain. So be aware of pain. What else? After 3-4 days, the pain was a little bit less, but I had another issue. The dizziness stopped after 48 hours or so. I was not dizzy anymore. Nausea, I took nausea medicine. Pain was under control. So 4 or 5 days, 6 days, the pain was manageable with medication. Especially when I took ibuprofen, 600. The doctor prescribed 800, but I had 600, so I took 600 every 6 hours. And I took Tylenol in between, plus an extra medicine. They give me 5 milligrams of that every 4 hours, depending on how much pain I was in. So by day 9, 10, I was dizzy, losing my balance. I had difficulty walking, even to leave my room to come to the living room. Fall backward. At some point, my fiance gave me a walker to get around because he was so afraid that I'm gonna fall and break something. One time I fell on, but thank God I fell from the chair to a chair, so I didn't get hurt or anything. The next day, I called the clinic I called the hospital to explain what was going on. Oh, I had a fever also. I had a low-grade fever from 99, then it go up to 100.8. I took Tylenol, the fever went down, but the dizziness, loss of balance, that didn't go nowhere. So when I called them, they said, okay, you have to go get blood work done. So I went and get blood work done, and just to find out I was anemic. My H&H went down to 8.6 to 29. Some people okay with a level hemoglobin of 8, but not everybody, because I was falling, dizzy, lost my balance a few times. So mine wasn't good. And when the nurse called to tell me I was anemic, still I didn't ask how much blood did I lose blood. How much blood? I lost a lot of blood then. I didn't want to ask them because I was afraid they're gonna ask me to come back for blood transfusion. Of course, at the level of 8 and 29, they don't do blood transfusion at that level. But for me, my body was acting up really bad. So anyway, I became anemic 10-12 days post myomectomy. So be aware of that. If you anything like that happen, if you're going for myomectomy, just watch out. Maybe put yourself on good iron, multiple vitamins. I was eating well, but apparently I lost blood and nobody said anything to me. That's the point. The pain was less by 2 weeks, 2.5 weeks. The pain was much less, but still I could not go on my side. and transfer myself standing up was still a problem. Besides the pain, I think that was the biggest issue. After the pain was the anemic. I became anemic, and how did I fix that? Oh, I went back to eating normal. Oh, I forgot, sorry. Forgot something always. My appetite was poor. So I was not eating much. I was not eating well. I was not taking my multiple vitamins. So when I became anemic, instead of going for back to meet with the doctor, I don't know what the decision was gonna be. So I decided to go back to my eating routine. Even if I had poor appetite, I tried to just eat a lot of vegetables and fruits, beans. I ate meat also, even if I don't do too much of red meat, but at that time I had to put something in there. So I ate a good amount of meat, fruits, vegetables, multiple vitamins. And 2 months later, my blood work went back to normal, no more anemic. I think that's all I'm gonna say for now. I don't want the video to be too long, then people will get bored with it. I think that's it. I'm okay now. It's been 6 months later. I still feel something when I walk fast, or if I try to do a little bit of exercise. If I walk fast, I feel like something is there. No more pain, but I feel like there is something healing down there, which is the C-section cut. This one is healing, but still I can feel like there is something there, so maybe it's not completely healed yet. But I think I'm ready to go for the next transfer after my appointment. Like I said on my last video, after my appointment regarding the elevated prolactin, which was 60. So I'll go back and continue, hopefully get it transferred soon. So post myomectomy, pain, lot of pain, dizziness, nausea, poor appetite. I became anemic. That was my post myomectomy symptoms. Everything, my body kind of feel like back to normal right now, but I have to keep praying and keep eating well and do a little bit of exercise as much as I can, so I can go back for my to get that, continue that TTCing moment. Okay, I think that's it. That's it for the video. Nobody will watch it if it's too long. Anyway, thank you guys for watching. Whoever click on my video, please don't forget to subscribe before you leave. Like the video, comment if you have any questions. I know I didn't say everything about my myomectomy. If there is anything specific you watch that video you want to know, feel free to post a comment. I will definitely get back to everybody. Please don't forget to subscribe so we can stay connected. Thanks for watching. I'll see you next time.